reason for looking for some form of laser therapy is because I'm very holistic in my approach. So even though I'm trained as a surgeon, my core belief is that the body has an innate ability to heal itself. So that being said, I looked for things that would align with patients' natural healing. And I looked at other lasers as well, but I found the reviews that I saw with Remy were just amazing. The physicians who had been using them, I trusted their opinions. And quite honestly, the support that I got through David and the whole team was just tremendous. So those were the things that I was looking for that I actually, you guys delivered, but you over delivered actually. There's an old saying that if you only have a hammer, then everything's a nail. And I think as a surgeon, we tend to go more towards a surgical approach. And that's fine, but I really don't think it's the best approach for helping patients because again, I do believe with everything within me that the body has an innate ability to heal itself. And my dad would say that you're out of order. With his Jamaican accent, he said, man, you're out of order. So that which is out of order needs to be put back into order. And we're really just reordering patients. We're reestablishing their foundation. And when we can get rid of that inflammatory process, then we can help them line up so that they can begin the auto healing ability again, because every single cell in our body is designed to heal itself. Our job is really to help the patient align with that natural healing. In my opinion, surgery is not just a physical thing that you do to patients. It actually has a spiritual and an emotional component as well. So when you're taking a patient to surgery, we're actually inflicting a form of damage, right? Because you have to cut the tissue. So we're inflicting damage. So to me, the healing process is tremendously more to go through a surgical process when I can leave say for instance, the bone spur, right? I can leave the bone spur because technically it's typically not the bone spur that's causing the problem, say for instance, with plantar fasciitis, right? It's usually the soft tissue that's inflamed. So if I can balance the foot, reestablish the balance, and get in with the laser to decrease the inflammation at the site, I'm in essence treating the problem and the symptoms simultaneously. Now, when I did surgical releases or when I did the exostectomies for removing the plantar heel spurs, those patients, sometimes they did 100%, they did magnificent, but a lot of them would have problems down the road. And I don't think surgical intervention, in my 20 years of now practicing as a solo practitioner, I find that I've moved away from a lot of the traditional surgeries that we did because I really don't think they're in the best interest of patients, because when you remove an important part of what was originally created, then something else is going to have to be in its place to take the support. So when you're cutting that band or whatever the newest, greatest things that we're doing, I really think we have to take a look at how we can better do what we used to do. And to me, laser therapy is one of the most amazing things because again, when we're increasing the oxygen to the tissue, we're promoting healing. How often can we say that we're going to the mitochondrial level, increasing the oxygen, the ATPase, all the stuff we learned in school, but we can now apply it. So to me, knowledge of a thing is wonderful, but it's really the application of the knowledge that really makes the difference. And I think as practitioners and also educators, our job is to, like anything else, like if we're taking somebody to surgery, we give them all the information and allow them to make the informed consent. But I've used the pain laser therapy and also the nail laser therapy, and I've seen phenomenal results. I'm treating Achilles tendonitis, ankle sprains, first MPJ, any type of inflammatory condition in the lower extremity. I've been using it successfully to treat. I also have a shockwave therapy. And what I find is if I try to use the shockwave therapy when they're in an acute inflammatory phase, it's excruciating. So to me, it's not humane to do that. But when I use the pain laser, they actually have an immediate noticeable where they walk around and they're like, oh, wow, this is significant. So there's an immediate decrease in the pain when they leave my office, actually when they're leaving the treatment chair. So I wanted something that would work pretty instantaneously, because a lot of